video is going to cover wrist flexion extension MMT testing, as well as the variations we have to test the wrist flexors and extensors separately to promote either more ulnar deviation or more radial deviation. So first I'm going to show you just composite, so all the flexors, flexor MMT, all the extensor MMT, and then we'll isolate the different muscles. So for flexion, you're going to have the patient supinated, right, so that we can move against gravity. MMT, so the same rules apply, passive range of motion, active range of motion, test position. So take them passively. Okay, go ahead and do that same motion for me. Good. You can stabilize lightly at the forearm because a compensation might be this, right? Elbow flexion instead of just plain wrist flexion. And then you're going to take them into the test position, which is flexion of the wrist. You're going to hold onto the palm of the hand, not on the fingers, right? Not close to the wrist, but onto the palm of the hand. So hold it up here for me. Okay, hold me here, don't let me move you. And I'm going to try to extend the wrist. Okay, so that would be a 5 out of 5. 4 out of 5 would be tolerated moderate resistance. We know he's already at least a 3. For gravity reduced, you just put the forearm in neutral, right? And you can have the patient perform flexion to look at a 2 out of 5. You can put something on the table to help them slide a little bit easier, like a pillowcase on a slide board, something like that. You could put your hand underneath it too, so that you just reduce the friction of the table. But again, we're not helping them move, we're just reducing friction. And then a 1 would be palpating really any of your finger flexors. So if you can feel any activation of the tendons on the medial side of your forearm or in the muscle bellies, then I would call that a 1 out of 5 if you feel that when they're trying to flex their wrist. And then the rule here says, right, we can use pluses and minuses if we change positions. So that's true for wrist flexion then. So if they could only go through greater than 50 but less than 100% of range of motion against gravity, that would be a 3 minus. Less than 50% against gravity would be a 2 plus. Greater than 50% gravity reduced would be a 2 minus, and then less than 50% gravity reduced would be a 1 plus. The opposite is what we're going to do for wrist extension. So instead of starting with the patient in supination, we'll flip them into pronation. Okay, same rules here, right? Passive range of motion, active range of motion. Go and do that for me. Good. He's at least a 3. I'm going to pull him into wrist extension. Okay, I'm going to stabilize at the proximal forearm, so I'm not just like pulling his arm across the table, right? And I'm going to say, hold me here, don't let me move you. And I'm going to try to flex his wrist out of that position. Okay, so it was a 5 out of 5. Grading is the exact same as it was for wrist flexion. So you can have pluses and minuses because here's our gravity reduced position, right? So again, for a 2 out of 5, you would just have them extend in this position, and you can grade pluses or minuses based on the percentage amount of range of motion they were able to do, either in gravity reduced or against gravity. And then your 1 out of 5, so your palpation is really any of your wrist extensors. If you feel activation, then that counts. That's a 1 out of 5. Or the muscle bellies as they come off that lateral epicondyle. If you feel activation in any of those on the dorsal side of the forearm as they're trying to extend their wrist, then that's a 1 out of 5. Okay, so those are the composite aggregate ways that we would measure wrist flexion, wrist extension, MMT. Now we can isolate specific muscles, right? So if we're talking about extension, we can isolate your extensor carpi radialis brevis and longus, which are going to be radialis, so on your thumb side, right? And extensor carpi ulnaris, which is going to be on your ulnar side or your pinky side, okay? So with these motions, it helps to isolate extension alongside either radial or ulnar deviation, okay? So you're going to passively kind of slightly extend and then take them into radial deviation to isolate the extensor carpi radialis brevis and longus. And then for extensor carpi ulnaris, slight extension and ulnar deviation. And then you would perform the resistance in that same position, right? So passive range of motion. Could you do that motion again for me? Good. And relax. And then go back one more time. Now I'm going to pull to isolate extensor carpi radialis brevis and longus. I'm going to pull him into flexion and ulnar deviation. Stabilize proximal. Ready? Hold it. Let me move you. Good. And then the opposite would be true for extensor carpi ulnaris. I would go through all my steps. Hold it. Let me move you. And pull into flexion and radial deviation. Okay. You can do the exact same thing for the flexors. So flexor carpi ulnaris would be flexion and ulnar deviation. Flexor carpi radialis would be flexion and radial deviation. I'm going to set them up a little bit more right here and say, okay, so this is the motion here, flexion and ulnar deviation. Could you do that again for me? Good. And then one more time, hold it there for me. I'm going to pull into extension and radial deviation, stabilize proximally. You notice all my pressure is always on the palm, never on the fingers, right? Because we could really hurt fingers that way. And then the last one, right, would be flexion and radial deviation. And there's not going to be a ton of motion here, so don't just jam your patient over there, right? There's a lot more ulnar than there is radial deviation, so keep that in mind. So we're going to go into flexion and radial deviation. Okay, can you do that motion for me? Good. And then go back one more time. Hold me there, don't let me move you. I'm pulling into extension and ulnar deviation to resist your flexor carpi radialis. At least all of those in the name tell you what side of the wrist they should be on, right? Flexor or extensor, and radialis or ulnaris, so that you know which ones you're testing. You can also do straight ulnar deviation or radial deviation testing, which again is going to be a composite of multiple muscles, right? So if you're doing ulnar deviation, then you're testing your flexor carpi ulnaris and your extensor carpi ulnaris in their ability to ulnarly deviate the wrist. And so this one, the difference here is that we're not going to do it against gravity. So we're not going to change positions if we're doing straight ulnar or radial deviation. So passive range of motion, go ahead and do that motion for me. Good. And then one more time, I'm just going to pull straight into radial deviation. Hold it, let me move you. With a proximal stabilizing hand. I'm not flexing or extending, so I'm not isolating a specific muscle. I'm just getting the composite muscles that ulnarly deviate. And then you can do the same thing for radial deviation. With this one, I would caution and say, don't grab around the thumb and push. Even if no one has pain there, that could be kind of uncomfortable, but especially if somebody has any thumb issues. But I reach into the hand, almost like I'm shaking his hand, right? Reach in here so that my pressure is on the palm, and I can push ulnarly here to test radial deviation. So I would have him, I would passively radial deviate. Okay, do that same motion again. Good. And you see how he pulled into extension a little bit? That's common because that's the easier direction to go, because again, there's not much motion there. So I would just correct him again and say, can you go straight to the side? Perfect, good. So that's a 3 out of 5. I'm gonna put him there one more time, say hold, don't let me move you, and push him into ulnar deviation. Okay, that was a lot. So composite flexion, composite extension, composite ulnar deviation, composite radial deviation. The rule says that if we change positions to gravity eliminated, then we can have pluses and minuses. So for flexion and extension, we can have pluses and minuses because we go against gravity and then we go gravity reduced. For ulnar and radial deviation, can we have pluses and minuses? No, because we don't change positions. So that would mean a 2 out of 5 for ulnar and radial deviation would just be partial range of motion. You can also isolate a specific muscle in the wrist. So the flexor carpi ulnaris, flexor carpi radialis, right? There are 4 different groups that we can isolate. For those, if I was isolating those, what I would do is test the isolation for 3, 4, and 5, like we just showed you, okay? And then if I had to go gravity reduced, I would keep it simple and just say flexion and just say extension based on which muscle I was testing. For example, if I tested extensor carpi ulnaris and he couldn't get through full range of motion on his own, I'm going to take him here and I'm just going to have him do extension gravity reduced. And I'm not going to worry about trying to isolate that specific muscle in a gravity-reduced position because it's going to be really hard to do. So again, for the isolated muscles, those 4 different muscle groups we said, 3, 4, 5, test like we showed you against gravity. When you go gravity reduced, just keep it composite extension or composite flexion based on the muscle that it is you're trying to test.